Today, we're going on a journey, tracing the life of an Indian woman. But this isn't just any story. We're going to look at a lifetime of overlooked health challenges, from the very first years of adolescence all the way through menopause. This isn't just a story about biology or medicine. It's really about a pervasive culture of silence. For generations, talking about things like menstruation or sexual pain or menopause, it's all been taboo. We're going to unpack how that silence, combined with this incredible resilience, really shapes the health of millions of women. Okay, let's dive into a concept that researchers call the double burden. I want you to picture a collision. So on one side, you've got these persistent, traditional issues like reproductive tract infections. And on the other, you've got this rising tide of modern lifestyle conditions. Think PCOS, think breast cancer, often tied to things like urbanization and changing diets. And Indian women are caught right in the middle of this health crisis. And that's exactly why this is so much more than just a medical story. As this quote points out, to really get what's going on, you have to look beyond the doctor's office. You have to look at these powerful social forces, things like gender, caste, and money, that decide who gets information, who gets care, and frankly, whose pain is actually taken seriously. So let's begin where it all starts, adolescence. This is such a critical time. It's the moment where lifelong patterns and beliefs about a woman's body and her health, both the good and the bad, really start to take root. So just think about it for a second. A young girl gets her first period. Who does she turn to? Where is she getting her information from? A doctor? A teacher? The answer, well, it might actually surprise you. Get this, more than half of all young girls, a whopping 54%, learn about menstruation from their mothers. And while that's great for emotional support, it often means that generational myths and restrictive taboos get passed down instead of hard medical facts. And look at the contrast. Less than 10% learn from teachers or health workers, the very people who are trained to give accurate information. And this is where the protective power of education just becomes so incredibly clear. Among girls who have no schooling at all, 18% become teenage mothers. But for those with 12 or more years of education, that number absolutely plummets to just 4%. It's one of the most effective health interventions there is, period. So India actually has a policy on the books for sexuality education. It's called the RKSK program. And on paper, it's supposed to cover really important topics like consent and safe sex. But in practice, it's a different story. Teachers, often worried about backlash from the community, water it down to these vague life skills, and they skip the most crucial topics. This huge gap between policy and practice leaves a whole generation of young people totally unprepared. Okay, so from adolescence, let's move into adulthood. This is where we enter the reproductive years, and a whole new set of complex, and often hidden, disorders become a major part of the story for so many women. 42 million. Just let that number sink in. That's the estimated number of women in India suffering from endometriosis, which is this chronic, incredibly painful, inflammatory disease. We're talking about a hidden epidemic. And here's the heartbreaking reason why it stays hidden for so long. For years, women are told that their debilitating pain is just normal period pain, or they're told it'll just be cured by pregnancy. This cultural normalization of female pain leads to an average diagnostic delay of 6 to 8 years. That is nearly a decade of suffering before a woman gets a real answer. Now, let's talk about another major condition, PCOS. In India, it often shows up differently. Doctors have a term for it. The thin, fat Indian phenotype. So what does that mean? It means Indian women might have a lower body weight, a lower BMI, but they carry more of this dangerous visceral fat. That's the fat around their organs. This leads to higher insulin resistance, which puts them at a much greater risk for diabetes and heart problems at a much, much younger age. So how do you treat infections in areas with limited resources? Well, India has this really clever system using color-coded kits. A doctor matches a patient's symptoms, their syndrome, to a pre-packaged kit. Like the green one is for vaginitis. It's actually a brilliant way to get people immediate treatment without waiting for lab results. But there's a downside. It is at its core an educated guess, and sometimes that guess can misdiagnose something way more serious, like early-stage cancer as just a simple infection, delaying life-saving treatment. All right, next up, we're moving into the menopausal years. And just like with PCOS, the experience for Indian women is pretty distinct from what's typically seen in the West, and it comes with its own unique set of challenges. So check this out. On average, Indian women enter menopause at age 46. That's nearly 5 years earlier than their Western counterparts. And that's a huge deal because it means they spend a much larger part of their lives in an estrogen-deficient state, which increases their risks for things like osteoporosis and heart disease. The symptoms are different too. In India, it's less about those well-known hot flashes and more about general aches, pains, and sleep problems, symptoms that often get dismissed as just, getting old. So, you'd think with all these symptoms, treatment would be widespread, right? Well, it's incredibly rare, and a huge reason for that is this massive knowledge gap. Only about 35% of Indian women have even heard of hormone replacement therapy, or HRT, which is the most effective treatment out there. And this lack of awareness isn't just among patients, it's an issue for many doctors too. Okay, so let's move to our final section. When you pull all these unique factors together, the case for proactive, India-specific health guidelines becomes undeniable. It's just crystal clear that copy-pasting medical advice from the West simply is not going to work.
This right here is maybe one of the most critical takeaways of this entire explainer. In India, breast cancer peaks in women aged 40 to 50. That's a full decade earlier than in the West. That is why Indian guidelines from organizations like FOGGI recommend starting mammograms at age 40, not 50. This isn't just about a number, it's a life-saving adjustment based on what the local data is telling us.
The products women use every day matter too. For instance, a lot of popular intimate washes are actually regulated as cosmetics, not as drugs. That means their health claims aren't rigorously tested, and sometimes they can disrupt the body's natural balance and do more harm than good. But on a more positive note, sanitary napkins now have to meet mandatory safety standards, which is a really crucial step forward to ensure basic hygiene and prevent infection. So, what's the path forward? What can be done? Well, the research really points to 3 clear, actionable steps. First, we've got to revitalize sexuality education so it's direct, it's comprehensive, it teaches consent, not just vague life skills. Second, fully adopt those age-appropriate Indian screening guidelines for things like breast cancer. And third, properly regulate intimate care products to make sure they're safe.
But at the end of the day, it all comes back to this. The technology, the medicine, the policies, they can only go so far. Real, meaningful progress begins when that culture of silence is finally dismantled, when women's pain is believed, and when their health across their entire lifespan is finally, truly made a priority.